Hello, and welcome to the Feeling Good podcast, where you can learn powerful techniques to change the way you feel. I am your host, Dr. Rhonda Borowski, and joining me here in the Murrieta studio is Dr. David Burns. Dr. Burns is a pioneer in the development of cognitive behavioral therapy and the creator of the new team therapy. He is the author of Feeling Good, which has sold over 5 million copies in the United States and has been translated into over 30 languages. His latest book, Feeling Great, contains powerful new techniques that make rapid recovery possible for many people struggling with depression and anxiety. Dr. Burns is currently an emeritus adjunct professor of clinical psychiatry at Stanford University School of Medicine.
Hello, Rhonda.
Hi, David. Hi, Matt.
Hello, Rhonda and David. Great to be with you again. Hi.
Good to see you.
Yeah.
It's been quite a while, Matt.
It has been a while. I'm glad to be back with you again.
Oh, yeah, I agree. Absolutely.
And we want to welcome all of our listeners. This is episode 305. And today will be another Ask David. And we are lucky enough this time to have Matt join us.
Oh,
and
thank you, Rhonda.
Yes. I thought I would read an endorsement that was related to you, Matt, regarding episode 294 on Acceptance Revisited. And Daniela wrote us and said, I think your podcast discussions are so interesting, educational, authentic, and supportive. The way all of you share your personal knowledge and experience helps us better understand mental health issues and options to manage our own. Regarding this episode, I have a question about unhealthy acceptance behavior of paralysis. Is paralysis the same as resistance and procrastination? Do you have any suggestions for replacing it with positive forms of acceptance so we can maximize our health by taking realistic and successful actions? It's such an honor and an opportunity to interact with you. So that was from Daniela, and she's not just sending an endorsement, but asking us a question too.
Well, there is one hell of a mind-blowing answer to that question, and Matt will now provide it.
David. Well, I'm not sure.
I didn't even get what the question was.
The question
exactly.
is unhealthy acceptance behavior of paralysis. Is paralysis the same as resistance and procrastination? And do you have any suggestions for replacing paralysis with positive forms of acceptance so we can maximize our health?
Well, I would just cut to the chase here and say that Matt might be able to, but I can't answer vague questions like that with kind of abstract words strung together. And but since you sent us such a beautiful endorsement, I would say send us an email, reword your question, and give us some specific problem you had at a specific time of day. What was going on? What you were upset about that might relate to those, acceptance, healthy or unhealthy acceptance or procrastination or something like that. And then we can help you in a specific way. And to my way of thinking, that's where all the learning becomes multidimensional. But just addressing, on a general level, we can answer it, but it won't relate to whatever you're thinking about. Like, of course, there's unhealthy acceptance, like if you have the thought, I'm a loser, and then unhealthy acceptance would be, yes, I am a bit of a loser. And that's unhealthy acceptance because it's just kind of buying into the same thing that you already told yourself, and it's associated with just more despair and hopelessness. But healthy acceptance would be, come on, David, cut out the shit. You have plenty of flaws, but the idea that you're a loser is just kind of nonsensical drivel. What are we talking about here? Is there something you lost at, David? Is there some error you made? Let's make it real. And that, I would say, is more of a kind of healthy acceptance. But as I just said, my answer won't mean a thing to you because it's not related to what you're thinking about. And so give us some specific example that where you need help figuring out if your acceptance is healthy or not, or if you want help with procrastination, and we would be glad to focus on that.
Yeah, I like what you're saying there, David. We don't really understand yet what she means by paralysis.
Yeah.
And what's a moment in time where she was paralyzed, and what was she thinking and feeling? And then we could get into the off to the races at that point. We'd have the information we need to be answering that question in a very specific way.
Yeah, right. A lot of wisdom in what you just said, Matt. Okay, let's go on to some of our Ask David and Matt questions for today. And I might say that I don't know if you folks ever look at the show notes, but these will be kind of especially interesting for you because usually just I write them. But in this case, Matt went through like 13 questions and wrote pretty elaborate responses, and in addition to my very brief responses, and it'll all be in the show notes. So check it out if you like.
Yeah.
Okay. Should we start out with Nick?
Okay. So Nick asked about general relationship problems, and he wrote, "Dear David, thank you for all the amazing work you do. Your books and podcasts have helped me to understand and start to transform a lot of negative and unwanted frames that I carry around. I'm also working with a level 3 therapist who I found through the Feeling Good Institute," which is really a wise thing for him to do. "One area I'm working on is building my empathy skills using the 5 Secrets model. I see how powerful it is in situations where both people are open to a positive relationship. But I struggle with the idea that each of us creates our own interpersonal reality and can always create a positive outcome regardless of the other person. Can you help me understand how to apply the technique to some challenging situations? For example, what happens if you want a positive relationship with the other person, but they fundamentally do not? I find that this situation leads the other person to react to the 5 secrets with anger or indifference. Or if the other person views you as weak for exposing your emotions and vulnerability and tries to exploit them for an advantage over you, is it even worth trying to have a positive relationship with such a person?"
Well, I'll give you first shot at this one, Matt.
Okay, yeah, I've got a couple of thoughts here. And it's related to something you taught me, David, which is that at the source of relationship problems, there's blame. And I agree with you, and I wonder if maybe Nick's question is really getting into that a little bit. That if someone doesn't want to participate with him in his definition of what would be a positive relationship, the approach that might be most effective would be some 5 secrets and empathy, but also open hands to stop demanding that this other person engage in our vision of what a positive relationship is. So the open hands idea is that we can, in that position, we can accept and receive if this other person would like to have a relationship with us, but we can also let go. We're not trying to force or push or pull that other person, and that sort of respectful stance is a good part of how to interact with people. And the closest we got to a specific example of something that this other person might be saying that we would respond to, we could imagine that this other person is saying, "I don't want to have a relationship with you." And we can use the 5 secrets with open hands there and say something along the lines of, you're right. I've been disrespectful and inappropriately pushing you too hard in the direction of having a relationship with me. I'm embarrassed, but appreciate your letting me know clearly that this is something that you don't want. And while I can imagine you might be angry with me, I'm sure you don't want to talk about that, but prefer instead to end this relationship as quickly as possible. I'm feeling awkward and would like to get out of your hair so that I don't irritate you more. Is there anything you need from me to facilitate this before we part ways? And to try to go with the other person's agenda.
Yeah, that sounds great to me. I personally never like to chase after people. I let people come to me. I don't think I've ever chased anyone that ended up in a positive way. And one of the biggest errors people make in dating is, chasing after someone, which forces the other person to run in the other direction as fast as possible. But I would add, in addition, Nick, that you're asking a vague question without any specifics. And Matt gave a lovely answer, about as good as can be, but it probably wasn't a very good answer because it probably has nothing to do with your situation. And you didn't give us any information. You're in this never land of abstract ideas. And, what did the other person say? And what did you say next? Use the relationship journal. There are tools in the Feeling Good Together book where you can zero in on a particular moment where you're having trouble in a relationship and put down what the other person says, what you said next. And everything will be revealed, both on the philosophical level and on the practical level, too. So I do appreciate your writing, but I'm trying to somewhat unsuccessfully school our listeners into asking answerable questions. And an answerable question, to my way of thinking, has a specific example of something that you want help with. And has some details so we can see what was really going on.
Excellent point, David.
Really good point. He asked another question, but it's another vague question. So
on page 4, is that the one you're looking at?
Right. Should I read that one?
Yeah, sure. This is another question of Nick's.
Correct. So Nick asked, what if you believe the other person does have a fundamental desire for a good relationship, but they are so attached to their anger, their fear, or their depression that their only reaction is hostility and defense? Perhaps such a person can't or won't admit to their emotions and rejects the empathy. Should you keep trying? And at what point, if any, should you give up?
I would say, send me tell me what the other person said and what you said next. All I need is 2 sentences, and I can answer all of your dreams, all of your philosophical issues, and show you exactly what you're doing wrong that's driving the other person away. I think Matt is going to comment on this too, but when you say, but they are so attached to their anger, fear, or depression that their only reaction is hostility and defense. Well, what you're not seeing is you're forcing them to have anger, fear, and depression. You're creating your own interpersonal reality, but by not giving us the details, we can't prove that to you or show you what to do to turn it around. But put it in your own words, Matt, because I get a little impatient and you're 10 times kinder and wiser than I am. So,
well, that's I don't know if that's true or not, but I agree. I think the specific example is really important here. It does, like what I'm hearing still seems related to the blame game, that there's a kind of a demand that the other person change and stop being hostile and defensive. But it's our demand that we stop doing that will make them more hostile and defensive. And there are a lot of other approaches that we could use here. But the relationship journal would be a good tool. Forced empathy could be useful, or an interpersonal downward arrow. But I wouldn't know until I had the example right in front of me.
Well stated, Matt. I couldn't agree more.
Okay, well, Nick asked one more question on page 5. Perhaps the other person is mistaken or lying about the facts and unwilling to admit it. Or you disbelieve what they say because it doesn't match their actions or is calculated to deflect blame. For example, you may have a conflict over who cleans the house. The objective fact is that you do this 80% of the time and have done it the last 5 times in a row, while the other person has consistently left garbage lying around. But the other person says, I feel like you never do housework and I'm always the one cleaning and I'm sick of it. How can you find truth in such a statement?
Hey, Nick, you're halfway home. You put down what the other person said, but you didn't put what you said next. And I might never have mentioned this on the show, If you want help with a relationship problem, write down what the other person said and exactly what you said next. This is another example, Nick, where you're blaming the other person, and you can go ahead and do that if you like. Blame is addictive. It's the cause of all the suffering in the world, but it makes people euphoric because you feel like you're right and they're wrong and you're morally superior. But if you use the relationship journal that's spelled out explicitly in Feeling Good Together, you'll be shocked to find out you're forcing the other person to be oppositional. The very blame that you're casting on them, it's going to come back and bite you. And if you have the courage to endure this, to see your own role in the problem, then you'll be empowered to turn it around. But anyway, that's my take on it. One of the things I say in Feeling Good Together is truth is the cause of all the suffering in the world today. And what that means is that when you go into a relationship problem, you'll almost always find someone who says, I'm right and the other person is wrong. And that is the cause of the problem. And that's what you're doing right here, Nick. Now, you may not want to hear what I have to say. Most people don't when it comes to relationships. But that's the doctrine according to Burns. And if you want it proven to you, if you have the courage, give us the other half of that. What did you say next? And then we'll take a look at how you communicated and what impact that's going to have on the other person. But Matt, I know I'm getting more and more out to lunch here with my irritable, impatient self. And so give it to us in a nice way.
I love your irritable, impatient self. I think you're trying to, actually do the best job you can possibly do helping people. And that does require these kind of specific examples. One thing that Nick's question caused me to reflect on a little bit is just how hard it can be to disarm. I heard him say, the objective fact is this, that he's doing all the cleaning. And one thing I would consider is, right, that holding on to that one fact, that one part of the truth is likely the thing that's causing the problem. Like you said, David, truth is one of the main errors that we make in our communication. And what we'd be looking for in disarming is to find the other person's truth. And I've got some ideas around that. Like, does the other person do the majority of the cooking? Or do they do the shopping or pay the bills? Or like, is their expectation that we would do more of the cleaning for some reason? Or
are they feeling unsupported?
In some other way. Yeah, what are we doing here that they're upset about?
Yeah.
And to try to understand that and see their truth rather than cling to our own.
And you can see right here that the statements that Nick is making are going to be hurtful to the other person. So when the other person says, you're not supporting me, well, here's the proof. You're really not, Nick.
So Nick asked a lot of specifics about, well, will the 5 secrets work in this situation or this situation or that situation? And I just want to say that the 5 secrets can work in any situation. Getting any conflict or any challenge in a relationship, if you apply the 5 secrets with humility and, really taking a look, like you said, Matt, at the other person's experience, they work. They're magnificently healing for the relationship and for each person individually. So your question is, does the 5 secrets work in this or that situation? The answer will be yes. I agree with you, Rhonda. Yeah, well said.
I agree too. And there's more examples that Nick gave, but I think we've been hard enough on Nick. Let me say that when I wrote Feeling Good Together, I didn't expect it would be a bestseller the way Feeling Good was, and I was right. But I'm proud of the book, and for those who really have the humility to want to get closer to another person, and have the courage to look at your own role and the way you're creating your own interpersonal reality, there's an awful lot there. It can be life transformative, but it's much more challenging, I would say, to get close, to develop a loving relationship than to overcome your own depression and get to a sense of self-esteem. That's not that hard in my experience usually, but interpersonal conflict, the resistance is far more intense.
It's very true. Yeah.
Okay, let's ask Debbie's question. Hi, David. I can't stop ruminating and obsessing about weird states of mind, or when I was afraid of harming someone or remembering. Everyone says to just let it go, but why do I keep hanging on? Where in your book can you help me?
Well, I'll just be brief. I don't know what book you're referring to, but When Panic Attacks is my best book on anxiety, and it sounds like you're struggling with anxiety and ruminations and obsessions and so forth, and also you can just search for anxiety on my website, and you'll find a whole bunch of podcasts on anxiety and OCD and so forth. There's also a free anxiety class on the website, so there's tremendous resources. And then the specific answer is that I suspect you'll find 10, 20, 30 techniques or more to overcome ruminations and obsessions and anxiety, but I suspect that one that's going to be a real knock the doors open is going to be the hidden emotion technique. And there's a beautiful chapter on it, and it explains exactly how it works. And almost everybody, the vast majority of people who ruminate and obsess, are upset about something you're not owning up to, and bringing it to conscious awareness and learning to be more open with your emotions. It's just one of 50 or 100 or more techniques I've developed, but it's often hugely helpful for anxiety. And now I'll pass it on to Matt.
David, I really loved your response to get into the hidden emotion, to bring that topic up, because when there's a kind of obsessive quality to rumination, that's one of the hidden emotion is one of the things that I want to make sure is on the list of methods that person's using to try to recover. I'd also point out they may be in a little bit of a trap if they're trying to stop ruminating or to stop thinking about something. I think the brain's not wired that way. Like you could try to stop thinking about a blue-eyed tiger, but the more you try to stop thinking about a blue-eyed tiger, the more you're going to think about it. And so one question would be, what would be her miracle cure? What would she like to be doing instead of ruminating? What would her life be like if she were cured? And to write that out. And then we could go through many other methods once we had that information.
Including exposure. Just like if you're afraid of harming someone, you have the courage to sit and fantasize about that. Make yourself as anxious as possible, and until your anxiety disappears. But I would have to, and that's a powerful technique. That's it's just enormously important in the treatment of all anxiety, but especially obsessions and ruminations. But with exposure, you might get a 50% improvement, but not 100%. And for 100%, you're going to have to deal with this hidden emotion phenomenon.
Well said. Yeah. If it's interesting, I mean, we could talk about some common patterns here, and the resistance might be that the idea that the rumination is protective.
Absolutely.
And that they're being responsible and preventing themselves from going into some weird state. If the more they ruminate, the safer they may be feeling. And then they might also prefer that state of mind to some other, even if it's sort of their miracle cure, it could seem too risky, too frightening to take a chance at a change, etc. And we want to admire the resistance and see how that's really moral and self-protective and other protective at the same time.
Mm-hmm.
Just a quick, brief example that I've given before on how these things can work out. I treated a tremendous person, a physician, who was a general practice doctor, and he worked with people who didn't have much money, so he was working 60 hours a week just to make ends meet. And his wife was pregnant. They had a baby, and then after the baby was born, he started obsessing about, what if I throw the baby over the railing in our apartment building? Now, Rhonda will now tell us what his hidden emotion was.
Well, it could have been a lot of things, but was it, could have been fear that he wasn't going to be able to provide for his family or take care of his family, or anger that he doesn't have time to do everything that he wants, or he doesn't have enough time to hang out with his child in the quality of time that he wants to do.
That's heading in the right direction. See, everyone who ruminates is an exceptionally nice person, and the niceness is the cause of the obsessions and the ruminations in most cases. And you see, he couldn't own up to the fact that he was angry that he had a new baby, because now he's got to change the diapers in the middle of the night, and he's already working 60 hours a week. And wouldn't it be natural to just say, I just want to get rid of this baby? But because he's so nice, he can't admit his ambivalence about having a baby. He thinks a father's supposed to love his baby all the time. And that's not true. We had two babies, and we love them most of the time, but sometimes they piss us off and we get ticked off. And if you're not comfortable with those feelings, you sweep them under the carpet, then you start obsessing and ruminating. And that's how it works. And bringing those feelings to conscious awareness can cause a tremendous liberation. That's just kind of a simplistic explanation of it, but it is a pretty simple technique and concept.
Mm-hmm.
I love what you're saying there, David. I noticed in the question, one thing that they said was that everyone keeps telling me to, what did they say?
Stop it.
Let go, but why do I hang on like that? Bob Newhart, stop it. Yeah.
I wonder how she feels towards people when they tell her, just let it go.
Yeah. Well, we know how she feels, don't we?
I have a guess.
Irritated and upset.
Yeah, irritated. And that's that kind of drivel that people do, cheerleading people and not listening, not giving people real warmth and support. That's some formulaic thing that's supposed to cure them. Well, great question, Debbie. Thanks for that. And thanks to all of you for your great questions. Should we go on to Dean?
Yes.
Matt?
Sounds great. Yeah.
So Dean asked, I'm having trouble sleeping. What should I do? Hi, Dr. Burns. I picked up a copy of Feeling Great, and I am excited to start reading it. I have been battling anxiety, depression, and severe chronic insomnia for the past year. Do I start with Team CBT for anxiety and depression and deal with that first, or do I supplement with CBTI for insomnia and do both at the same time? I met with the Mayo Clinic last fall, and they said the root cause of insomnia is some depression. I've been to a lot of doctors, specialists, and therapists, but so far no one has been able to help. Thank you.
Take it away, Matt.
Got a couple of thoughts on this. So I'll just share briefly. One response I've heard to the question, how do I get to sleep at night, that I really like is a paradoxical one, which is, see if you can stay awake. But I'll move on to more. I think the main question here, this individual's trying to structure they're making some decisions about how to structure their treatment, what to address first and that kind of thing. And I wanted to I think there's some confusing points that could be worth just clarifying. One is that having a diagnosis like anxiety or depression is sort of like a diagnosis of cough or fever, that there could be a lot of different things underlying and causing cough or fever, like bacteria or viruses or allergic reactions or autoimmune disease or toxic exposures. And so we need more specificity to understand what is the sort of, what are the actual, thoughts and that are creating the symptoms that this person is experiencing before we'd be able to accurately select a good treatment. I'm also reminded of some training from medical school where we want to cast a very wide net and not to assume that we've got like the root cause nailed down, that but to have a sort of open mind when it comes to the treatment, because it's really hard to predict what's going to be effective for one given individual. So if multiple people have even the same kind of patterns of thoughts when they're suffering from insomnia, like they're saying, I must get some sleep, I'll never get to sleep, I'll feel terrible tomorrow, everything will go wrong because I'll be so sleepy, I'm a hopeless case, I'm a loser, I must get some, just repeats on that cycle. Even if the thoughts are identical, you could still have one person that responds to one set of methods and a different person that responds to a completely different set of methods. And the solution in team is to use the recovery circle. We don't know what's going to be effective, but we pull from a large group of methods and tools, and customize it to the individual. And each one has some chance of success. And then we fail as fast as possible to find the methods that are actually helpful for that individual, without assuming that we know the root cause or have the perfect understanding of the situation before we start in.
I have a few additional things to add, and perhaps you do as well, Rhonda. But I would say that insomnia is not a symptom of depression. That's a mistaken idea. In fact, I tested that in a group of 170 patients admitted to the Stanford inpatient psychiatric unit, measured depression. On the one hand, the psychological symptoms, hopelessness, depression, low self-esteem, worthlessness, loss of motivation, loss of pleasure in life, that type of thing on the one hand, and then difficulty sleeping on the other. And there was no correlation between them whatsoever. And the reason for that is that there are at least 50 things that can cause trouble sleeping. And so, even excitement can cause trouble sleeping, anger, jet lag, noise from the neighbors, all kinds of things.
Caffeine, alcohol, genetic conditions, right?
Right. The one thing, though, is that trouble sleeping can be a symptom of general distress, kind of like what we were talking about in the last question, kind of the hidden emotion model, but it's not generally that hidden with insomnia. But if there's something going on in your life that's bothering you, it would be a good idea to find out what that is and focus on it. Maybe it's a relationship problem, or maybe you don't like your job, that something's kind of eating away at you, and you're not dealing with it. Another thing that I thought that you said, Matt, that I thought was brilliant is the thoughts about the insomnia is where I've always put my emphasis. I've never tried to make somebody sleep more, but said, why is it upsetting to you that if you're having trouble sleeping, what are you telling yourself? And then you mentioned a lot of those thoughts, like, oh, I should sleep, I must sleep, this is terrible, and the problem is those thoughts, not the insomnia itself. I once had to give a workshop in Minnesota, and the flights were so screwed up. It took me, I think, like 15 hours to get there, or more from San Francisco.
Ooh.
And I was up all night, taking flight after flight. They were canceled, and I finally got into the airport about 40 minutes before the start of the workshop, and then I had to take a taxi. So I got to the hotel, just minutes before the audience was all there. They were all expecting me, and I'd been up all night. And I went in there and I said, "Here's the bad news: I'm dead tired. I've been up all night, and I can't even remember what the workshop is on. And here's the good news: I do my best work when I'm half asleep." So went ahead. We had a fantastic workshop because I wasn't making the assumption that I was going to be doing terrible because of the fact that I hadn't gotten any sleep. And then, Matt, you've mentioned sleep hygiene. Some medications can cause insomnia. If you're drinking heavily at night, you'll fall asleep and then you'll wake up in the middle of the night and have trouble sleeping. Caffeine and all the things that cause caffeine, if you take them in the afternoon or evening, they're going to keep you up. I mean, those are pretty obvious things. There's standardized things I'm sure you'll find in that app you have called Sleep Hygiene, just covering the basis of the things to do, but I also say don't fight the insomnia. I've always myself looked forward to insomnia, because if I'm having trouble sleeping, I just get up and I go into the TV room and I bring the cat with me and put her on my lap and she starts purring happily and I just get caught up on some TV until I'm tired, and then I go in bed and fall asleep again. So those are just a few things. It's a very common problem, Dean. I don't know how many Americans have trouble sleeping, at least a good bit of the time, but I'll bet that's a real high percentage.
Well, both of you are so awesome, giving Dean a lot to think about and ponder. A lot of really good feedback and advice. I appreciate that.
Yeah.
I think he will too.
Yeah, but I met with the Mayo Clinic last fall, and they said that the root cause of the insomnia is some depression. That's not true, in my opinion, and my research absolutely does not bear that out. But if you're depressed, then get one of my books like Feeling Good or Feeling Great and write down your negative thoughts, identify the distortions in them, and see if you can crush those thoughts. And when your depression goes away, when you feel a sense of joy, I suspect you'll be sleeping way better also. Oh, and one last thing, don't ever take sleeping pills, because that's the most common cause of insomnia. Sleeping pills and benzodiazepines only work for 3 days. And after that, they become addictive. And then the withdrawal is insomnia. That's how people get hooked on sleeping pills. Now, there are some things you can take. You can take 2 regular strength Tylenol and crunch them up in your mouth, chew them and swallow them with water. That'll put you to sleep. And they're not addictive. And you can add to them, if you want, a 25 milligram Benadryl pill. Chew that also and swallow it. And the chewing puts it into your blood system very, very quickly. And they will often help you get to sleep, those two combined, and they're not addictive.
All excellent thoughts.
Really great. Okay, here's a question from Kathy. She's asking a question about social panic and the hidden emotion technique. Hi, Dr. Burns. Thank you so much for all the great information you put out there. I had a question about the hidden emotion technique. If I experienced dizziness in a social setting 10 years ago, and now I panic whenever I'm in a similar situation anticipating the dizziness, is there still a connection to the original emotion that is hidden, or is it a habit at this point? Thank you so much. Kathy.
Well, again, I would just say you got a daily mood log. Use the techniques in my book. Write down your negative thoughts, identify the distortions in them, and see if you can crush them. And also, is there something that you're upset about? My daughter got very dizzy in a social situation and had a panic attack and thought she was going crazy, and she was very distressed. This was probably 15 years ago. And then I asked her, were you upset with somebody in that situation? And she said, as a matter of fact, I was. And then she started talking about this other woman she was kind of ticked off at, and suddenly her anxiety and her panic disappeared. And that's that hidden emotion thing. But the connection to the original emotion, that to me is kind of malarkey talk. I know a lot of psychologists like to talk fancy like that. Oh, there's a connection between this feeling and some hidden feeling in the past. And just to me, that just seems like pure BS. But social anxiety is so treatable, and there's tons of podcasts on social anxiety. Rhonda, you and I've done some fantastic work on social anxiety. You just go to the podcast, feelinggood.com, take the search button and put social anxiety or shyness or panic attacks. You'll find tons of podcasts on that, all for free. There's a free anxiety class on my website. I'll shut up.
That was great, David. One thing about the hidden emotion is it's something that's happening in this person's life right now. When they're experiencing the hidden emotion, they don't have to go back in time and try to remember what was going on 10 years ago or during their childhood. It's something that's currently going on in their life. And so if she's still experiencing this, we could do things like some uncovering techniques, like, what if you get real dizzy here? What are you most worried about? And then if it's a social anxiety, is she thinking that other people will judge her or look down on her? And is it possible that that's the hidden emotion, that she might feel kind of angry with people for judging her, looking down on her if she gets dizzy?
And for myself personally, I always use self-disclosure. I used to have 5 different kinds of social anxiety, intense, all of them. And when I feel that way, I just find a way to say it, but not for people to pity me or help me. I was teaching. Oh boy, I probably told this story. Oh well, I'm elderly and demented, so if you've heard this story 3 times, enjoy the 4th. But I was teaching at Kaiser when we first moved to California from Philadelphia, and I went down for a half a day a week to do a workshop in one of their psychology type clinics, and then they didn't have a department chairman, and then they hired one. Some guy had been at Harvard, and they were going to have a reception for him. And they wanted me to sit next to him at the reception because I'd been teaching, and I was saying, I don't want to sit next to this guy. I don't know him. I'm a very socially anxious person. But I couldn't say that, And then they said, oh, and we want you to meet with him before the reception in his office. And here's his CV, his resume. And I looked at it, and he had all of these awards, and he was like one of these big shots from Harvard. And I felt so inadequate and anxious. I said, oh, God, what am I going to do? And I'm going to have to sit in this guy's office and chat with him. And so when I went into his office, I said, let me tell you something here before we got started. If I look nervous, that's because that's the way I'm feeling right now, because I looked at your CV. They showed me your CV, your resume, and I was blown away. I can't believe all the things you've accomplished, the awards you've won, the positions you've had, the research you've done. And I'm just feeling kind of really anxious and intimidated because I'm so filled with admiration for all that you've accomplished. And I think they'll just be so excited. They are so excited to have you here at Kaiser. And boy, when I said that, he practically started licking my shoes. He was so grateful and happy. So that's the way I do it. I try to be open about it and not hide these feelings, but to say them in a way that will allow people to feel closer to you and to see you as human and vulnerable. But if you say, oh, I'm so nervous, am I okay? Please help me. Then people will get all nervous and think that you're being kind of pathetic. So there's an art form in the way you do it.
One thing that you helped me out with, David, was realizing that maybe the problem is more with social anxiety is more around shame than with anxiety.
Yeah.
It's that holding back of our feelings that creates that tension. And once we let it out and, oh, here's how I'm feeling, that tension is gone.
Right. I couldn't agree more. Well, how are we doing, Rhonda? And
we are doing really great, but we have, let's see how long we've been recording for 45 minutes. So shall we stop now and then do another one?
I guess number 5 is really juicy. We're going to have another podcast. Should we start with number 5 then on the borderline personality disorder?
Yes, we'll tease people in the interest.
Okay, so if you want to hear a juicy question on how to have a healthy relationship with someone with borderline personality disorder, tune in next week. And thank you all for tuning in and sending in your questions. And I apologize if I'm a little hard on some of you sometimes, but I'm trying to shock you into a new and different mindset. I'm so grateful to work with you, Rhonda, and you, Matt. Not only because of your genius, both of you, but because of your warmth and compassion and wisdom.
Oh, right back at you, David.
No, right back at you.
Yeah, thanks. And thank you, Rhonda. You just do a wonderful job making this all happen.
Thank you. You guys are really sweet.
This has been another episode of the Feeling Good podcast. For more information, visit Dr. Burns' website at feelinggood.com, where you will find the show notes under the podcast page. You will also find archives of previous episodes and many resources for therapists and non-therapists. We welcome your comments and questions. If you want to support the show, please share the podcast with people who might benefit from it. You could also go to iTunes and leave a 5-star rating. I am your host, Rhonda Borowski, the director of the Feeling Great Therapy Center. We hope you enjoyed this episode. I invite you to join us next time for another episode of the Feeling Good podcast.